Hello, this is Dr. Aldoori. We're going to talk today about stroke. We're going to talk about types, prevention, and management. Stroke can occur when the blood flow to the brain is blocked or there is a sudden bleeding in the brain. There are two types, ischemic and hemorrhagic. The leaked blood results in pressure on the brain cell and causes damage. Just under 90% of stroke involve a blocked vessel, and this is the ischemic. The rest of them seems to be hemorrhagic. Stroke are further classified on what part of the brain it affects and where the bleeding occurs. A stroke is a medical emergency, can cause lasting brain damage, long-term disability, or even death. Signs of stroke can range from mild weakness to paralysis or numbness on one side of the body. Other signs may include sudden severe headache, muscle weakness on one side of the body, speech difficulty, one side of the face droops. The signs and symptoms of stroke can occur quickly. However, they can develop over a period of several days or even hours. Sometimes when transient ischemic attack, where there is a blockage and release before damage of the brain, turn into stroke. So the management has to follow the signs of TIA. Signs of TIA or stroke can show either sudden confusion, sudden numbness, weakness, sudden severe headache, or no cause, no cause, seeing, unable to seeing from both eyes or one eye, sudden trouble walking, dizziness, or loss of balance, or coordination. The FAST test can help remember how to deal with these cases. The FAST, F stands for the patient, asking the patient to smile, and if you see one side of the face drooping. The A stands for ask the patient to raise the arm up and down and see what happens if it drifts. S shows ask the patient to repeat simple phrases and see if his speaking is slurred or strange. T, observe these signs and call 911 right away. Early treatment is essential. If you or someone else is having a TIA, do not go by the car or let someone drive. You call 911 as the ambulance team can start management immediately. The complication of a stroke, the dangerous blood clot may form. Being unable to move around for a long time can increase the risk of developing a blood clot in the deep veins of the legs. In some cases, blood clot can break loose and travel to the lung. Your stroke team may try to prevent these complications with medicines or device that puts pressure on the calves to prevent breaking of, to prevent flowing of the blood. Loss of blood or bowel control can occur. Some stroke affect the muscles needs in terms of nutrition or bowel movement. You may need urinary catheter to be placed. The use of these catheters in can cause urinary infection. Loss of blood, loss of bone density or strength is common. This usually happens one side of the body, making physical activity part of your rehab. It can prevent the loss. Your care team also watch closely for any problem. Muscle weakness and inability to move can occur. Stroke can make your muscles very weak, and it causes them to go spasm. This can be painful or make it hard for you to stand or relax. Swelling in the brain also is possible. After a stroke, fluid can build up around the brain cell. Doctors may drain some fluid from the brain or cut away the skull to relieve the pressure. You may experience loss of vision, hearing, or both of them, touch, any neurological deficit. Your ability to feel pain, temperature can be altered. You may experience trouble swallowing, infection as a result of that, leading to pneumonia. Does the stroke affect the muscles used for swallowing? You may have difficulty eating or drinking. The diagnosis: your healthcare provider will order tests to help rule out other causes and other health problems with similar symptoms. Imaging tests look at the blood vessels in the brain. These images will help to determine what type of stroke the patient has and where it has happened in the brain. The faster the test that can be done, the better it is for the patient. We have first thing is CT scan, which is computed tomography. It uses X-ray radiology to take a clear, detailed picture of the brain, and it's often done right away in suspected cases. The CT scan shows whether the brain there is a bleeding or it's ischemic stroke. MRI, it's a radio event to create picture of the brain. An MRI will help instead in many cases. CT scan is used to diagnose a stroke. The test can identify changes in the brain tissue and the brain cell. Other imaging include digital subtraction angiography or positive emission tomography. Look for very narrowed vessel in the neck or aneurysm or arteriovenous malformation, tangled blood vessels. Your doctor must do blood tests for red cell, platelet, glucose, sugar, diabetes. These tests can also help determine whether there are specific medicine that you need to take. Your doctor may help also to do a blood test to see how well your blood is clotting and to look for muscle damage. Also, EKG is important here to find any problem, any heart issue that causes this. Lumbar puncture, spinal tap can be used if the imaging does not find any bleeding. In this test, the needle is inserted in the subdural space and blood withdrawn. It's very important to start medical, physical exam in a swift way. The medical history, your doctor should ask a family member about the factors that results in this. Tell the doctor and talk to him if you can speak. Your provider may also talk about signs and symptoms of stroke and when they began. And that is confusion, coordination problem, mental alertness, numbness, weakness of the face, arm, and leg, trouble speaking clearly. The exam helps the provider determine how severe the stroke is and plan treatment. Your doctor should look for signs and symptoms of carotid artery disease, common causes for ischemic problem, and they will listen to your carotid artery with the stethoscope. A whooshing sound called bruit may suggest changes in the diameter of the blood vessel. Causes of stroke: ischemic stroke, about 87% of stroke are ischemic. Blockage in the brain is usually caused by piece of a plaque or a closed blood vessel. If the blockage occurs locally in the brain, the condition is called thrombosis. If the blood clot travels through somewhere else in the body, it is called embolism. Ischemic stroke are classified specifically based on where in the brain the blockage occurs and where in the body an embolism developed. In some cases, the location of the original embolism is difficult. As you can see in this illustration, it shows how an ischemic stroke can occur in the brain. When a plaque builds up on the inner wall of the arteries, it can lead to disease called atherosclerosis. Plaque hardens and narrows the artery, limiting blood flow to a particular area. The plaque can build up in any artery of the body and causes ischemia. Carotid artery disease occurs when a plaque is built up in the artery, and sometimes it breaks. Blood platelets stick together. Blood clot leading to stroke can help when there are other heart and blood conditions, such as atrial fibrillation, sickle cell disease. MRI studies shows that as many as 40% of children with a stroke disease are due to sickle cell disease. Even though medical exam does not show signs of one, the only treatment for these undetected stroke is surgery. The causes, as we said, it's a chronic long-term inflammation that contributes to ischemic stroke. Transient ischemic attack caused by blockage of the brain, blockage in the brain vessels, just like the ischemic stroke. When a TIA develops, the clots breaks into small particles inside the brain. It typically lasts less than the stroke. A TIA is also called mini stroke. If youths are diagnosed with the TIA, an emergency room should follow and the patient treated swiftly. Sudden bleeding can cause hemorrhagic stroke. This can happen when an artery at the top of the brain breaks and bleeds for some reason. There are risk factors associated leading to stroke, and that is high blood pressure, obesity, physical inactivity, poor diet, and smoking. Ischemic hemorrhagic shock shares many of the same risk factor, which like blood pressure, high blood pressure, diabetes, high cholesterol, other risk factors that are specific to the type of stroke. Blood clot can arise from coronary artery heart disease, atrial fibrillation, heart valve disease, carotid artery disease. Bleeding can occur after taking blood thinner. Other risk factors including the age, anxiety. Anxiety has an issue here because it will increase the blood pressure one way or another, and that can lead to a stroke. Family history and any genetic role has a contribution to the causes of stroke. Your risk of having a stroke is higher if your parent had a stroke or a family member, particularly at a younger age. Certain genes affect your stroke, including those that determine the blood type. People with type AB, which is not common, have higher risk of stroke. Living or working in an area with air pollution can also contribute to having stroke. Other medical conditions like sleep apnea, kidney disease, migraine headache are also factors, and using illegal drugs like cocaine may raise the risk of stroke. Race ethnicity is another factor. In the United States, stroke occur more common in the black people. Alaska and Native American and Hispanic population higher than white. Sex can play a role in risk of stroke. At a younger age, men are more likely than women to develop stroke, but women who take birth control or use hormone replacement therapy have higher risk. Women are also at higher risk during pregnancy, and if the weeks after birth, and in the weeks after birth, high blood pressure during the pregnancy can result in developing stroke. Viral infection also is very important. How to treat? Treating ischemic, we'll start with ischemic stroke. A stroke requires emergency care. You'll probably receive treatment in a specialized stroke unit. Treatment of an ischemic stroke may include medical procedure. The main treatment is using tissue plasminogen activator, TPA. It breaks the blood clots that blocks the vessel in the brain. Healthcare provider will inject the TPA in the brain in your arm. This type of medicine must be given within 3 hours of the stroke, of the symptoms start. People who may still have large parts of the brain without major damage may benefit from this treatment. Your provider may give TPA up to 4.5 hours after the symptoms start. If you woke up with a stroke less than 4.5 hours beforehand, the sooner the treatment is implemented, the better it is. Then following recovery, the use of aspirin and clopidogrel is very important. The medical procedures, you may need to have some procedures on your blocked arteries to enhance blood flow. Thrombectomy and removal of a clot in the blood vessel. A surgeon can put a long flexible tube called catheter into your upper thigh and thread it to the blocked artery in the neck or the brain. They use angioplasty or stenting or a device called stent retriever to open the blocked artery. Angioplasty and stent procedure use a thin tube insert a balloon or mesh tube into the artery, gently blowing the balloon or expanding the mesh, clear the space and restore the blood flow. The stent retriever is a wire mesh inside the catheter that traps the clot. The retriever and the blood clot are then pulled out through the tube. In addition to treating blockage or bleeding that causes stroke, a healthcare provider needs to suggest, first of all, breathing support is very necessary. If your stroke makes it hard for you to breathe, you need to be on a ventilator. Compression therapy using air-filled sleeves on your legs lower the risk of thromboembolism. Feeding tube may be used, and if it is hard for you to eat. Fluid may help to restore circulation volume and restore blood pressure. Medicine may be used to lower fever. Your provider will watch your temperature and your personal need and help with it. Rehabilitation should be planned and recommended before leaving the hospital. In the recovery can help, lifestyle changes can help to recover from the stroke. Now, we need to choose healthy, heart-healthy food, aim at a healthy weight, manage stress, get regular exercise, quit smoking, get enough good quality sleep. What is the healthy living? The first step toward healthy living, reduce the risk of heart disease. Your risk depends on many factors. Some of them are changeable, others are not. Risk factors are condition, habits that increase risk of developing disease. These risk factors may be different for each person. Preventing heart disease, to start with knowing what your risk factors are. We spoke about risk factor. It could be heart disease, could be high blood pressure, could be high cholesterol, obesity, diabetes, and smoking. Do not get regular physical activity. Have some family history. If you don't get physical activity, family history, the genetics plays a role. During pregnancy, have an unhealthy eating disorder, age 55 or older. After the stroke, you may need rehabilitation, help you to recover. Rehab may be occurring with a speech, physical, occupational therapy. Your healthcare provider may also recommend medicines that manage the stroke. Bladder and bowel problems should be addressed. Language and speech therapy and memory reinforcement should be stressed. Muscle and nerve problem, stroke may affect only one side of the body. It can cause muscle weakness and paralysis, and in this case, rehab because of increased risk of falling. Swallowing and eating problem can occur, and the patient needs to see a speech therapist that helps her with exercises. And there may be suggestion of changing the type of food that the patient eats. You can see that this subject is wide, and it involves a multidisciplinary team to treat with one patient, and it's always better to prevent than to treat. End of dictation. Thank you for listening.